We can start by now.
Okay. 皆さん、こんにちは。こんにちは。今日はですね、ニベディタ先生の、セッションあります。で、Yoga Therapy for Asthma and Common Cough and Cold、喘息と、普通の風邪についてのヨガセラピーというテーマです。で、ニベディタ先生、よろしくお願いします。
Hello everyone, namaste. Konnichiwa. So, 今日のトピックは Yoga Therapy for Asthma and Common Cough and Cold. So, I'll be explaining in detail the reason and causes and how to cure. Okay, let's start. So, first of all, let us know what is asthma. So, asthma is a condition where the air passages lungs become inflamed. When the air passages get inflamed, it becomes thin and swollen. It starts to swell and sticky mucus produce. Asthma is a condition to restlessness due to problem in dissatisfactory exhalation. It causes coughing, wheezing, shortness of breathing, and a tightness in chest. So first is asthma is a condition where the air passes lungs become inflamed. So the Nasal Symptoms inflamed. Can you please explain what is inflamed? 喘息のことですと、喘息アスタマは肺の気道が炎症を起こした状態ですと思うね。
はい、大丈夫です。はい、perfect。はい。
気道が炎症を起こすと赤く腫れ始め、寝気が出てきます。その後、喘息は不十分な呼吸の問題による落ち着きのなさの状態ですね。Okay, let's see how it looks like. So, when in normal condition, the air passes looks like this. 普通の時このように見えるね。But when during asthma attack, the air passes got swollen like this. So, and the mucus start forming and this passage. So as this air passage becomes very thin, so the patient cannot breathe nicely. It becomes really hard to breathe in. Yeah, so when we look this picture, so 普通の時の写真はこのように見えます。So when the 筋肉ごめんなさいね。筋肉がスウェレンすると、このように薄くなって、呼吸の問題になって、it's become really hard to breathe in. Let's move on to next. Let's see what are the symptoms of when asthma attacks happens. So the patients usually sneeze a lot. Sneezing is often worse at night or early in the morning. It makes hard to sleep. So, sneezing はくしゃみね。くしゃみはいつもくしゃみは出ることになりますね、この状態に。And it's become worse early in the morning. So, at night and in the early morning, sneezing くしゃみはひどくなって、眠りはもうよくできない状態になります。Then next point is wheezing is a whistling or squeaky sound that occurs when the patient breathes. So usually wheezing の音は何か変な音になって、whistling sounds also it's make like a whistling sounds. And next is chest tightness. The patient may feel like chest getting squeezed or like something kept on one's chest. So 胸も重くなったり感じると、何かit's like breathing becomes really hard. So chest also becomes very you feel very tightness and something very uncomfortable while breathing. So yeah, it's next is shortness of breath. Next, when patients feel that they cannot catch the breathing, or they feel out of breath, or feel like they cannot get out of the air from the lungs. So usually what happens while in this condition, patient cannot breathe well, and the exhalation got worsened. Like inhalation is a little bit better, but he cannot exhale well. So 吸うことは大丈夫けど、吐くことはすごく問題になって、よく吐くなくて、胸は痛くなって、すごくいろいろ問題はペーセントは感じていると思う。Then symptoms like shortness of breath, difficulty in breathing, dry cough, night cough, wheezing, chest pain or tightness. So the already we discussed previous slides that shortness of breath. It was like running out of breath. The patient feels like running out of breath. Difficulty in breathing. Again, same. He cannot breathe well. Dry cough. So sometimes the patient cough. The patient has dry cough also, and night cough. Nerutoki mo itsumo 咳とか出たり、wheezing sound とかしたり、chest pain or tightness also, like he feel pain, 痛くて胸が痛くなって、重くなって、いろいろ状態になってよく寝ない感じ。So what are the other reasons? Like strong emotion and stress triggers asthma. So some examples of strong emotions that can trigger asthma symptoms are anger, fear, excitement, laughter, yelling, and crying. So it's not only that only when you are in stress, that time only the patient got the attack of asthma. It also laughter and excitement, yelling, crying, all these emotions trigger asthma. Because when all these emotion happens, what happens? Our breathing changes. Like in all these emotion, our breathing got very faster. So the patient cannot breathe well. That's why whenever he is really very angry, or he has fear or excitement, laughter, yelling, crying, all these emotion happens, the patient starts makes using wheezing sound, or he cannot breathe well, and soon the attacks occur. So it is not the emotion itself that causes the asthma symptoms. Instead, your breathing changes during emotion, and it causes muscles to tighten up your breathing, rare in many cases, rare to increase. Sorry, rare. That causes muscles to tighten up or your breathing rate to increase. A little bit, I cannot read the slide because due to the. Can I close?
All right.
Can I close the side? Okay, I'll continue. No problem.
Sorry, what? Nibedita Sensei, you want to say something?
Yeah, the side pictures, small pictures, I cannot, it is disturbing the slide. So can I?
Okay.
Full slide, I'm just asking. No problem, I'll continue.
Is that the full slide now? Now can you see it?
Just little part, side sentence are cutting, so I cannot read.
Oh, okay. Is it possible that your camera needs to be in the different this thing angle? Because I can read it fully when I keep the phone in a vertical angle.
No problem, we'll continue if
or I can read the slides for you if you want. I can see the slides clearly.
I can read only little part, some sentence are break, like last word is.
Okay.
So that's
okay, please let me know if at all I can read the whole thing.
Yeah, I'll be making some mistake.
Thank you. Sorry to disturb.
1 or 2 words are missing. Okay, no problem. I'll continue. So how we can, which slide I was in? Oh, okay, next is trigger points of asthma. So what are the main reasons the asthma occurs? What are the main trigger points? So first is pollen. So maybe everybody is knowing when during the pollen, kafunso no toki mo asthma wa hidoku naru koto ne. And another is smoking. Smoking, the people who smokes a lot, for them also it's like the trigger becomes really easy for them, and the patients, like anybody smoking near the patients also, it may have that trigger may happen immediately for the patient. And exercise, when the patient is doing more exercise, like the breathing become really faster. So maybe slow exercise is good, but sometimes the patients are doing a lot of exercise, running and aerobic and Zumba, these kind of exercise sometimes may the patients like get the attack of asthma. That time also it triggers the asthma for the patients. And the moldy is dani toka, iroiro dani toka also it make the it's also easy to trigger the asthma patients. And infections like many kind of virus infection in chest, like cough and cold and flu. These infection also it triggers asthma easily. And next is food. Tabemono mo iroiro tabemono mo allergy tabemono toka tabette mo asthma trigger mo hidoku naru kamo shirenai. Then その後は薬ねと薬のアレルギーもあってその薬飲んだり時々アストマトリガーはその時もひどくなります。Then dust mite, dust who have dust allergy also, as usually the people have dust allergy. It is easy for them to like get the asthma trigger. So dust allergy とか then 次はストレスね今少し前もストレスのいろいろポイントもストレスとエモーションのいろいろポイントも説明してたけど時々ストレスになってすごく呼吸はチェンジで変わりますね。すごく呼吸は吸うこと吐くことそんなにできなくてストレスになってアストマのトリガーはひどくなります。その後ポリューションね、エアポリューション。エアポリューションもう一つ理由です。そう、エアポリューションポリューションがすごくひどくなるところに行くと、その時もアストマもひどくなります。あとはペットね、ペットとか家にいると、そのペットのフォーね、フォーは鼻に呼吸するとき鼻の中にit's go inside the nasal passage and then also the asthma like triggers happens. And その後は cold air。cold air は冷気ね。冷気も時々すごくコールドプレイスに住みたい。冬の時ね。冬の時 and when 雪降る時その時もアストマもひどくなるかもしれない。Then let's after knowing many causes why this happens. Is my slide missing now?
Yes, Sensei, we cannot see the slide right now.
Can you see the slide now?
Not yet. Yes, Yogic management, we can see it.
Okay. So after knowing the causes and trigger point of asthma, now let us discuss asthma management. So when we know what are the causes of asthma, then now we can manage the asthma trigger point. So let's see how we can manage asthma. So first, we discussed many different causes like environmental point and emotions and cold and cough. So first of all, we'll discuss environmental control, how we can manage asthma by environmental control. So let's see what are the points. Some ways to change the environmental in order to lessen the chance of an attack is next one is the clean the house at least once a week and wear mask while doing it. So it is really important to clean the house always, because the dust and dani, these are the main reason of asthma attack. So soji ba mainichi suru koto wa sugoku daiji ne. アストマのペーセントが家にいるとき、毎日カーペットとかピローとかバキュームとかすることは毎日するはすごく大事。Next point is avoid pets with fur or feathers. So next 次は家にペットとか飼うとそれもすごくアストマペストのアタックはひどくなるなら、それペットとかもアボイドすることも大事です。次はwash the bed sheets, pillowcase, mattress cover weekly. With hot water. So every week the patients using the bed sheets, pillowcase and mattress cover, it should be clean every week so that it will be clean and the dust will not be there to protect the asthma patient. Next is in case the mattress, pillow, bed sheets, bed cover, etc. is dust proof. So we can like the patient should use the mattress, pillow and bed sheet, bed cover which are really dust proof, so it will protect the patients from the dust. And next is consider replacing carpeting with hardwood floor or tiles. So carpet to ni sugoku dust ba like tamaru kara carpet no igai carpet to sukawa ju ni ie ni tairi to ka suka 使うとすごくいいことね。その後、keep the humidity in the house low。家のヒュミディティはローにエアコンとか使って、ヒュミディファイアとか使って、家のヒュミディティはローにすることです。Let's next move on to next. Next is yogic management. So what we discussed environmental control. So next is how we can manage the asthma by doing yogic kriyas and asanas and pranayama. All these yogic system we can use to control the asthma. So first is Satkarma and Kriyas. So Satkarma, as we know, Satkarma is to cleanse our body from various mucus and dust. It helps to cleanse our whole body. So what are these? Like Jalaneti, it's a really very popular process to cleanse our nasal passage. Nowadays, it's like doctors are also saying to use this Jalaneti to the regular patients, not only the yoga instructor, also doctor also started saying this to use the Jalaneti to clean the nasal passage. And Sutraneti also, you can use Sutraneti, like putting a thread inside the nasal and like taking out from the mouth and doing like moving it up and down. This will clean them easily, the mucus will come out. And it will clear the nasal passages, and all the dust and allergen, everything will come out by doing this kriya. Next is Kapalbhati. So Kapalbhati is like forcefully exhalation. By doing Kapalbhati also, we exhale forcefully many times. So whatever mucus or allergy things are there inside our nasal passages, it will come out. And also it will reduce the chances of asthma. Next is Kunjal. So Kunjal is cleansing of our stomach. So in Kunjal, what we do, we drink a lot of water, and we forcefully vomit, and we bring out all the mucus and bacteria, whatever in our stomach. It will come out by doing Kunjal and clean the stomach nicely. So when in the air passes, the mucus release. So what happens? It come in near to our nasal passages, and it come to our mouth, and it goes to our stomach. So these are the Satkriyas. By doing these Satkriyas, we can clean our nasal passages, our mouth, and our stomach also. So like this, it helps. Satkriya helps. Last is Vastra Dhoti. Nowadays, it's really hard to do Vastra Dhoti, but previously people are used to doing cleansing their stomach and all the intestine by doing Vastra Dhoti, by putting one thin cloth inside inside the stomach, slowly, and slowly taking out from the mouth. It also cleanses the stomach nicely. So, Satkarma ba Jalaneti to Sutraneti to Kapalbhati Kunjal to Vastra Dhoti. This. So, kono yoni iroiro cleansing kriya sitara nasal passages to kuchi to stomach kara iroiro bacteria to ka dete kurunara asthma attack wa sunnani hidoku naranai yoni narimasu. Next is Sitilikaran Vayam, loosening practice. So in loosening practice, we do warm up, and we move all the joints. So what happens when for the asthma patients, the body becomes really, he feels really heaviness in his body. So loosening practice really helps to feel really relax the body of the asthma patients. So next is asanas. All chest expanding asanas recommended. So for the asthma patients, all the chest expanding asthma, munes to ka mune hiroku na naru iroiro asana pose to ka yaru to asthma patient nara sugoku ii koto desu ne. So then to regain the normalcy in breathing practice, individual capacities to regain the normalcy in the breathing practice. And next is regular practice required. So it's not one day or once or twice in a week. So for a better condition, the patient needs to practice regularly. It is the key point that the patient needs to practice regularly all the yogic management, so that he can feel the improvement in his condition, every day, and or more more time he can practice in a week, 3 to 4 times also. It's good. So let's go to next slide. So these are the list of practice. As we are here discussing the yogic management or yoga therapy for asthma, so in detail we are discussing what we should do for the things the patients should practice. First thing is breathing practices, hands in and out, like hands in and out like this. If we are expanding our hand and bringing it back, so while expanding our hand, what we are doing, we are expanding our chest also. Munemo like with the hand, teva hiroku to munemo ishoni hirokimasu nara sugoku kokyu wa muneni. When we inhale, sugoku kokyu wa muneni ippai kokyu wa ireru koto ni narimasu. Then hand stretch breathing, Sasankashana breathing, dog breathing, tiger breathing, Setubandhasana. Kono iro breathing suru to nagaku sukoto, nagaku hakukoto suru to ikuri su to ikuri hakuto, the patient feel very relaxed, because the main problem for the asthma patient is the breathing problem. So, sostera iro pose suru toki ikuri sutte ikuri haite sono yoni iro pose suru to sugoku relax na kanji to mo. Next is Sitilikaran Vayam, and these are the Vayam list. These are the poses list. What the patient should do: forward and backward bending, spinal twist, Kati Chakrasana, and side bending, elbow movements, arm rotations. These are also the loosening practice we discussed. These are same type of Sitlikaran Vyayama also. And next is Surya Namaskar. This is the basic. This is the basic asanas the patient should do. So first he should do Surya Namaskar, all the 12 postures with the mantra also, and with the breathing practice also. The patients can practice Surya Namaskar first. Next is asanas. What are the asanas he should practice? One is Tadasana, Trikonasana, Ardhakati Chakrasana, Ardha Chakrasana, Padahastasana. All these asana involves our chest. And while bending backside, the chest becomes the patient expand the chest, and while bending to the front, the blood flow will go nicely towards the lungs and towards the heart. Next is so these are the few asanas I have included here with the picture for asthma patients, and pranayama also. The first is Nadi Sodhan Pranayama. The patients should practice Nadi Sodhan Pranayama. Being all alternative, everybody of us, we know what is Nadi Sodhan Pranayama, alternative nostril breathing. So inhaling with the left nostril, exhaling with the right. 左鼻から吸って右から吐いて右から吸って左から吐いてこのようにこのプラナヤマブリーディングプラクティスをプラクティスすることです。
Sensei, sorry to interrupt. Did you want to share the pictures of the asanas also, because we cannot see that slide?
Already I shared, I think.
Oh, really? We are not able to. We are just. I can see the yogic management side. This thing slide only for all the time.
No?
I'm not sure about. No, not yet.
No? Which slide? In practice?
Same. The yogic management slide.
No?
Up until now, we could see all the slides, but since I think you also talked about some of the slides, but zutto yogic management no slide no mama desu ne. Minasan mo sou desu ka?
Really?
Yes. Asana slide とか皆さん今見えてますか？誰かアンミュートしていただいてシェアし。
見えてないです。
見えてないんですね。ありがとうございます。Yes, we are unable to see it.
Okay, let me check. Should I share again?
Yes, just the asanas part, even if you could share the asana slide, the latest that you were.
I'm actually in my screen, it is coming.
Okay. Onajiku miete inai desu. Yes, I don't think people are able to see it. Now we can see breathing practices.
Okay. And now?
Now we can see the asana. Even breathing practices, earlier we couldn't see it.
So again, I'm explaining this side. Yeah?
Yes, please. Thank you.
First is what we talked is yogic management. So I'm explaining the yogic.
Yes, yogic management. Until yogic management, it was clear.
I'm just reviewing. So in yogic management, we are doing Satkarma Kriyas. Then Sithilikaran Vyayama, Asanas, individual capacity of to make the breathing normal, to bring the breathing in normal. Then next is regular practice required. Yeah, it's every day the patient has to practice. Mainichi rensu suru practice yoga mainichi practice suru koto ne. So now let's move on to the breathing in detail. Let's discuss all the yogic management in detail. So yoga therapy for asthma, these are the list the patients every day should practice. Mainichi kono yoni list ba rensu suru koto. So mainichi kono yoni rensu suru to dandan kyomochi to karada wa kawaru koto ne. So as in breathing practice, asthma is mainly it's a problem of breathing. That's why we need to practice with the breathing, all the posture, and there are many breathing practice in yoga. So first is hands in and out breathing, hands stretch breathing, Sasankasana breathing, dog breathing, tiger breathing, Setubandhasana breathing. So with this posture, we are also focusing with our breathing. Like the patient is focusing with the breathing on this posture. Next is Sithilikarana Vyayama. And again, all the loosening practice we discussed, same forward and backward bending, spinal twist, Kati Chakrasana, side bending, elbow movements, arm rotation, anti-clockwise and clockwise. So these are the Sithilikaran Vyayama. It involves mainly the chest and heart. So kono Sithilikaran Vyayama ba forward to backward bending to ka spine twist to ka Koti Chakrasana elbow movement kono iro Vyayama ba posture ba mainly involves like muni to heart, this area, the chest area, it involves mainly the chest area. So the patient feels good after doing all these postures. Next is Surya Namaskar. It's a common Surya Namaskar is really very important for every patient, including the asthma also. And again with the Surya Namaskar is Surya Namaskar va asana to pranayama to mantra no combination this ne. So kore dake mo sugoku nankai Surya Namaskar mo kokyu to ishoni suru to sore mo karada ba sugoku asthma no patient no karada ba sugoku kimochi to karada ba sugoku yoku naru to mo. So na asana no list. Kore ba tadasana, trikonasana to vrikshasana, ardhakati chakrasana and ardha chakrasana, padahastasana. Kore ba jembu ba batas include dekina kote sukunaku iro asthma no list ba kokoni include dekisitat. So kore jembu ba chest to karada. It includes mainly the chest part, and even bending to the side or bending to the back side, these twisting to the back, it mainly involves the chest part and lungs part. So these are few more asanas which the asthma patients should practice. Pranayama, this is the Nadi Sodhan Pranayama, like we know what is Nadi Sodhan Pranayama. It visible, right? The Sensei, it's visible, right?
Yes, Sensei, now we can see. Yes, thank you.
So the pranayama breathing practice is first I have explained like Nadi Sodhan Pranayama, alternative nostril breathing. It begins with begin with this pranayama to calm your mind. Like a patient can start with the Nadi Sodhan Pranayama, usually at the beginning or at the end or both time patient can practice this. So first he will calm down his mind and relieves the body and accumulated stress. Then he can start the other practice also. This breathing technique has a healing effect on many respiratory and circulatory systems. Because like in Nadi Sodhan Pranayama suruto patient ba like sugoku ikuri count sinagara sutte count sinagara hold sitte count sinagara haite kono yoni sukosi rensiu suruto dan no mind mo calm ni natte stress mo release sitte sono ato sugoku kimochi yoku natte iroiro rensiu deki. You can practice other. Then next is Kapalbhati Pranayam. It also really good like breathing practice for the asthma patients. These breathing techniques release the mind and energize the nervous system. It also clears the nadis, energy channels, and improves blood circulation. So while practicing Kapalbhati Pranayama, the patients release like all bad air and bad, all the allergic inside his nose and body, he starts releasing it. And he just energizes his nervous system and also clears all the nadis. The Kapalbhati also helps to clear all the nadis. and improve the blood circulation. Blood circulation mo yokku narimasu. Then next is Pavanamuktasana. Next I can see the third slide. Just a minute. Next is Pavanamuktasana, wind relieving pose. This pose is good for people with asthma and as it massages the abdomen organs and helps in digestion and release the gas. So yeah, Pavanamuktasana also helps to feel the patient it also give a nice massage to the abdomen organ, and also it give a massage to the chest. I didn't mention here, but also it give the nice massage to the chest and includes the abdomen. And next is Setubandhasana. In Setubandha, it's a really good posture. Setubandhasana, in this posture, it opens the chest and lungs and reduce thyroid problems. Also, it also improves the digestion and is very useful for the asthma patients. So in this posture, what happens? The patient really expand his chest nicely. He could expand his chest nicely, and he can feel the nice amount of air inside the lungs. So it helps the patients to breathe nicely. And next is another Dhyana Sensei. The sixth slide is Bhujangasana. I can't see this. The sixth slide is Bhujangasana. Is the sixth slide is Bhujangasana?
Sorry. Yes, it is. Yes. Bhujangasana.
Yeah, same Bhujangasana. In Bhujangasana also it helps to expand the chest and feel the chest with nice amount of air. It helps the asthma patients to expand the chest and very good amount of air. Asthma patient can inhale and exhale nicely. And Setubandhasana. So these are the asana again involves the chest part mainly. Setubandhasana, Dhanurasana, Bhujangasana, and Gomukhasana also. And Adho Mukha Sanasana, it also helps the down dog facing dog, this posture. So this asana calms the mind and relieves stress and is suitable for people suffering from asthma and sinusitis. So as we discussed, stress is another main reason for asthma. So stress ba mohitotsu ryu ne asthma attack trigger suru no tame stress mo mohitotsu ryu dakara stress do yatte stress wa release suru sore mo sugoku daiji nara iroiro pose site savasana site pranayama breathing practice site stress wa nakunaru yoni iroiro pose yarimasu. そしたら一つその間に一つがadhamukha svanasana, as we say in English, downward facing dog pose. So this also calms the mind and relieves the stress. And next is Baddha Konasana, butterflies pose. The this pose, the Baddha Konasana butterfly pose stimulates and improves the blood circulation, relieves fatigue, and has a therapeutic effect on asthma. So this is also very beneficial for the asthma patient. The asthma patient no tame kore mo sugoku daiji na Baddha Konasana mo sugoku daiji na pose desu. Let's move on to pranayama. As we discussed breathing practices few with the pose and asanas. Next we will discuss about pranayama. So Nadi Sodhi pranayama, Surya Ved, Vastrika, Sittali, Sitkari, and Brahmari pranayama. These are the pranayama the patients should practice regularly. Mainichi Nadi Sodhi pranayama to alternative nostril, Surya Vedana, and Vastrika, Sittali, Sitkari, Brahmari pranayama. These are the pranayama the patients should practice. So Nadi Sodhi pranayama, again breathing hitotsu hana kara haite hidari kara haite migi kara sutte migi kara sutte hidari kara haite kono yoni Nadi Sodhi alternative nostril pranayama practice suru to count sinagara ni go count to ka nana count jibunno karada ni yotte count sinagara kono yoni Nadi Sodhi pranayama suru to yukkuri mune ni yokku 呼吸が入れて、ゆっくりゆっくり吐いて、アスタマのペーシェントは吐くことがよくできないなら、このようにゆっくりゆっくりいろいろプラナヤマするとすごくhe will feel really relaxed. Next is Surya Vedana. Surya Vedana は右鼻から吐いて右鼻から吸うことね。左鼻閉じて右から吸って右から吐くと体はスリアエネルギーはアクティベートになりますね。スリアナディアクティベートになると体メタボリズムを上げてコールド、コフ、いろいろ問題はなくなります。バストリカもforceful inhalation and forceful exhalation. Exhale and inhalation both are active in Vastrika. So, これもメタボリズム上げて、体はすごく暖かくなって、it's kind of dynamic breathing practice. So, it will help the patient to release all the stress also. And it will help the patients to to relax the body from cough and cold. Next is Sitali and Sitkari Pranayama. So during summer, these are the two pranayama we practice during summer. Natsuno to Sitari to Sitkari yoho pranayama ba friends surukoto sugi ba Brahmari. Brahmari pranayama mo rensu suruko sugoku mind ba. So mind ba calm in alma. So stress relief. This is really very good pranayama for releasing all the stress. So while the patient is in stress before the trigger of asthma attack, when he feel really stressful time is going on, during that time he should practice Brahmari. It is advisable for the asthma patients to practice Brahmari pranayama regularly. Brahmari pranayama suruto 振動は口から頭から全体体に流せてると感じするの。this calms the mind and body together. Then next one, Nadi, Dhyana. So after pranayama, let's move on to Dhyanam, meso no koto. Nada Nusandhan. There are many types of there are many types of dhyana we do, meditation we do. So one is Nadi, Nada Nusandhana. Another one is Om meditation. These are two type of meditation asthma patients can practice. Nada Nusandhana wa sugoku raku ni suwatte uchi gawa ni meso shinagara, karada no uchi gawa ni meso shinagara, uchi gawa mimi mo tojite mo ii shi, sono mama suwatte mo ii shi, 内側の音が聞こえるように長く自然に座ること。そうするとだんだんこのようにメソは練習すると内側からいろいろ音が聞こえるようになりますと信じられるね。ドラムの音とか海の音とか風の音とかすごくいろいろ耳も閉じていいしそのまま座ってもいろいろ音が内側から聞こえるようになります。そのように長く座るとマインドもカームなるしストレスもリリースするしそれもプラクティスするとすごくいいことね。次はオンメディテーション。皆さん知ってると思う。オンメディテーションすごくメソがオンチャンしながらメソがよくできることになります。It's like very easy way to do meditation by sitting on straight and closing your eyes and chanting Om many times. As we know how to chant Om, it's easy to chant Om many times and releasing our thoughts. So Om ba chant suru toki, mantra ba chant suru toki, meso suru toだんだん集中はできるね。thought はいろいろ thought は頭の中に入らない。そしたらオウムだけチャンスしながら、ゆっくりゆっくりチャンスしながら瞑想すると、それもストレスリリースで、アスタマペーシェントにすごくマインドがカームになります。Let's move on to next. Okay, we discussed all about asthma. Next, move on to common cough and cold. So, in common cough and we all know what is cough and cold. The common cough and cold is a viral infection of your nose and throat, and it's affect the upper respiratory tract. It's usually harmless, and many type of virus can cause common cough and cold. Children younger than 6 are at greater risk of cold, and adult can also expect to have 2 or 3 colds annually. 一年の間に何回子供たちと大人も2回3回ぐらいコールドキャッチすることになる。これみんなはわかるね。その後 most people recover from a common cold in a week or 10 days. So usually it takes 1 week or 10 days to get well from the common cough and cold. It takes like mostly 1 week. So, and those people who smoke, for them, like it may take little more time. Let's move on to next. What causes a cold? Yeah, we know what mainly what are the main causes of cold, like in the cold weather or viral infection. Also, it due to the virus or infection also, and corona no toki minna sugoku corona no virus to iroiro virus no infection, cold infection ba sugoku yoku katsu. Then next is one can also catch a cold by touching contaminated object and surface and then touching one's eyes, nose or mouth. Sugoku minna wa kono koto bakaru ne. Virus wa iroiro contaminated object ni iru to sono to object to ka surface to ka touch suru to sono ato eyes, nose, mouth when we touch, then we it is easy to catch cough and cold. Same like infection in corona. Also, we are taking care by wearing mask and washing our hands many times. The next, so これをいろいろ symptoms ね、cold の symptoms みんなわかるけどもう少し説明します。Like nasal symptoms, running like running nose, congestion in nose, sinus pressure, runny nose, stuffy nose, loss of smell or taste. Cold の問題の時、このいろいろ symptoms, nasal symptoms. What are the nasal symptoms we are discussing? First is congestion. Congestion は何かブロッケージとかノーズにブロッケージとか感じる。その後サイナスプレス、サイナスの何かサイナスのいる人とかもサイナスプレッサーも感じる。Runny nose, yeah, we know it's like very easy to like during cold it's always runny nose. And stuffy nose, and loss of smell or taste also, sneezing, kusami toka dittari, watery nasal secretions, and post-nasal drip or drainage. Also, let's discuss next, head symptoms. So 3 symptoms we feel in during cold, like nasal symptoms, head symptoms, and whole body. So we discuss nasal symptoms. Next, let's move on to the head symptoms, watery eyes, headache, sore throat, cough, swollen lymph nodes. So these are the head symptoms during common cough and cold the patient feel. Then whole body system, the patient may feel fatigue, tiredness, chills, body aches, low grade fever, chest discomfort, difficulty in breathing. So, 体にフェティッドが感じて、タイヤネスとか疲れちゃうこの気持ちになって、時々、寒く感じたり、体痛くなったり、時々熱っぽいも感じる。チェストディスコンフォート、胸も何かディスコンフォート感じてます。Let's move on to next, how we can yogic management. For yogic management, such kriya like same like asthma. It's more or less same like asthma person. So I didn't included all the yogic management. Only roughly I have included. So all the sat kriyas in Satkama we discussed in asthma. Same we will do for common cough and cold. Like Javaneti, Sutraneti, Kapalbhati, Vastradhoti, Sikilikarana Vayama loosening practice. Next, we discuss about asanas, all chest expanding asanas recommended like Setubandhasana and Bhujangasana, Gomukhasana. We discussed in same like here in asanas. These are the same asanas we can practice for common cough and cold. What we are practicing for asthma. Asthma no onaji listo asana to sikilikaran vyayam onaji listo ba common cough and cold no to kimo rensi suru koto. So for this also we need to practice regularly. Common cough and cold no to chemo for better like management of better yogic management for common cough and cold. We need to practice regularly. There's minus rensu surkoto korimo mohisasin mountain pose. It opens the chest. Kono pose. Can you see the slide, Sensei? Slide ba miyuru kana?
Yes. Yes.
Okay, so this is the mountain pose, Tadasana, which bring awareness of your body. You will like je mukharadani shuchu dekiru kono pose ni dekiru. It open the chest, root chakra also. It involves the root chakra. Then standing forward bend, Uttanasana, like creating space for congestion, helps to ease stress. Increase circulation in this posture. Blood flows towards the chest and head. So nicely blood flow towards the chest and the head, and the patient feel relaxed after doing this posture. It helps to ease the stress. Next is down dog and Adha Mukha, or we can say Adha Mukha Sanasana. We discussed this in asthma. This is also help to relieve the stress as the blood flow towards the head and chest. Next, child posture. Great resting pose calms the brain and strengthens the back. This is also good for common cough and cold. Headstand. Fresh oxygen boosts circulation, strengthens shoulders. So this posture also helps the patients to boost the circulation, blood circulation, and also these are the posture which improve the immunity of the patients. So not only the patient, it's improve the immunity of everyone. So when we practice this posture every day, it develops our immunity, and so it is less. We are less prone to catch the cold and cough. This pose, Setubandhasana, this was also chest opening posture. It helps to fill the air, fill the lungs with lots of oxygen. Very relaxing posture. Seated forward bending, Paschimottanasana. Same, it helps to improve digestion and relax the back and head. Let's move on to the next slide. So wellness practice to beat your cold. So these are few things I have discussed here for like to relax your body and to feel good during cough and cold. First is mantra chanting. So it's really important to chant mantra every day for everyone. Though like it's really helpful to calm the mind for the patient of cough and cold also. So chanting mantra, or what is chanting means, like repeating the same sound many times is chanting, or repeating the sound of Om several times is chanting of Om mantra. Here's vibration that loosen the mucus in the nose, throat and lungs to keep everything moving. So what happens when the patient chants Om wa chant, my nankai chants suruto Om no vibration, but no, it helps mucus to ノーズとトロートとランスの中にいっぱいミックスは集めるね。それをオムチャンティングすると、オムのバイブレーションはこのミックスはリリースして、すごく、like, it helps to improve the lungs capacity. And begin and end your yoga practice by chanting Om at least 3 times. So it's like it's common for everyone though. Like every time before starting yoga practice and before ending the session, it's we practice chanting Om 3 times at least. 何回もチャンスしてもいいけど、at least は3回チャンスするとマインドもカームになってバイブレーションがすごく体に流れているかもしれない。The next is Pranayama, breathing practice. So we discussed what are the breathing practices practice during common cough and cold. Again, Kapalbhati breath, skull signing Kapalbhati breathing, skull signing breathing also, it's known as skull signing breathing, is a warming breath with rapid exhalation and belly button to spine motion. And Nadi Sodhan, alternative nostril breathing can clear the nose and enhance respiratory functions. Then posture, after breathing, again we'll discuss about posture. すごくいろいろポスチャーも前も説明したけど、もう一度少しリビューに。A gentle joint mobility series, soothing movements, and chest opening poses are helpful in supporting the immune system and clearing the congestion. すごくチェストはincludes するポーズとかリストにインクルードするとすごくいいこと。毎日プラクティスする、練習するとき、すごくチェストはインボルブすると楽に感じる。Like breeze pose, cobra pose, bow and camel, you'll feel better after some time on your mat. Then next is take care of your nose. It's really, really important to take care of nose for common cough and cold and asthma patient. Essential oil とか使ったりし、ネティポートね、ネティポートに水を、流行水を入れて、鼻に入れて、反対鼻から出て、そのようにクレンジングのいろいろクリアのこととかして、we should take care of our nasal passages also. So essential oil can give you a boost when you are suffering. Check out immunity, essential oil blend roller, and these are the things in list of the things how we can use during for your nasal passages. Next is stay hydrated. It's really important to stay hydrated. Sip on something soothing. 水とジュースとか、すごくいろいろ飲み物を飲むとすごく、like during cough and cold, you will feel better. Staying hydrated is essential to combating your cold. Warm lemon water and herbal teas. ワームレモンとハニーワターとかハーバルティーとかゆっくりゆっくり飲むと胸とコールドコフが楽になりますね。Then it can soothe your irritated throat and boost your body ability to recover quickly. If you drink warm water and lemon water, herbal tea, it will help to soothe your irritated throat. Throat もなんかイライラに感じるね、そのコールドコフの時。そうこのようにハーバルティーとか飲むとすごく楽になります。Rest to restore. Just chill. Yeah, this is very important to rest when you are like you have cough and cold or asthma attack. It's really, really important to rest. Or any whatever fever or whatever we have, we need to rest our body. And like we should give time to rest. Rest is key to a speedy recovery. So consider spending a day or two at home in bed. So when すごく風邪がひどくなるとその時少しリラックスした方がいいね。家にゆっくりしてベッドの上寝てティーとかレモンティーとか ハーバルティーとか飲んですごくリラックスすると早く治ることね、病気から治ることとかもしれない。Give your body the time it needs to heal while keeping those nasty germs to yourself. Thank you. Thank you so much. なんとなくI just completed. Nasal Sensei, if you want just review a little bit in Japanese.
Thank you very much, Sensei. I think all the things were very clear today, and it was just a revision of what we have been doing in many lectures until now. So thank you very much. It was a very good revision. 今までやったことを、ね、全部ね、また、ね、先生の方からもよく説明されて本当に良かったと思います。大体コモンヨガプロトコルのですね、アサナとかやったり、プラナヤも、あと瞑想チャンティングのことですね。では今日本当に先生も皆さんも、1時間お疲れ様でした。ではここで、この、ミーティングですね。終わらせていただきます。先生、Thank you very much. ありがとうございます。It's 12 o'clock. Thank you so much. 失礼します。ハシさん、you can